Hi, Mr. Johnson. I'm Cynthia Fawn, the social worker here in Dr. Clark's office. Nice to meet you.
Hi, I'm Chuck. If you call me Chuck, I'd appreciate it.
Sure, Chuck, and you can call me
Oh,
Cynthia.
thank you.
Now, Dr. Clark referred you here, and I want to make sure you understand why you're here today.
Not really. I'm not. I really don't know.
Okay, well, I can review that with you. Basically, we're doing an annual checkup of your habits and lifestyle, and I'm going to be asking you questions about your alcohol use, about tobacco, just to see if anything in your lifestyle might be impacting your health, and see how, that we can just have a better sense of what's going on with you. Does that make sense?
Yeah, that makes sense to me.
Okay, so I'm going to be asking a lot of questions, so I hope you'll bear with me with that. And as we're part of the same practice, the information you share with me will also be shared with Dr. Clark.
Okay.
And as you know, it doesn't go beyond that without your express written permission.
Okay.
So
Okay.
I know you've reviewed that already with Dr. Clark, but just wanted to reiterate that.
Okay. Yeah, because there are a lot of documents we sign to
There are.
for confidentiality, so I'm aware.
Okay, terrific. Well, then I think we're about ready to get started. I see you brought your medicines along with you. Can I take a look?
Yeah. I don't know why he wanted me to have these. I don't know what that has to do, but anyway. Here we are.
Remember, we were looking at your overall health.
No, that's
so
true. That's true.
It's a good, yeah. Okay. Cinepril. Is this for high blood pressure?
Yes, it is.
How long have you been taking that?
About 3 months.
3 months. Okay. So was that just discovered that you had high blood pressure at a regular
Yes,
checkup?
well, I had gained some weight, and that showed up as a high blood pressure issue.
Okay. Were you aware of the gaining weight? Or?
I was aware of the gaining weight, but not that it was
Okay.
affecting the blood pressure issue.
And you have some high cholesterol, I
Yes.
see. How long have you been taking
About
this?
4 years.
4 years. Have you had any other heart disease or a heart attack?
No,
Okay.
nothing else.
Terrific. And Cymbalta. How long have you been taking the Cymbalta?
Oh, about 6 months, I'd say. My wife died a few years ago, and I've been living alone, and so I just reached a point where I was not feeling well or positive about a lot of things, and my daughter suggested that perhaps I ought to talk to Dr. Clark about it, and he said, no, give this a try and see what happens.
Yeah, I'm sorry for your loss. Is it
Thank you.
helping?
Yes, I would say I have better moods because of that.
How long were you married?
42 years,
Oh, okay.
so it was a long time.
Yeah, so you probably miss her a lot.
Very much so. It's and yet I don't want to move into a place where there are a lot of people. I want to stay in my home. I like my independence, so it's a little lonesome, but the alternative doesn't appeal to me either.
Okay, so you're doing okay at home by yourself?
I would say yes, and I have family nearby.
Okay. Oh, what family?
I have a daughter nearby, and her husband, and a couple of grandchildren.
Oh, very nice.
So, they're about 30 minutes away, and so I see them with some regularity.
Is your daughter your only child?
No, I have another daughter in Texas.
Okay, oh, much further away.
Much further away. I don't see her very often.
Yeah. Okay, so we can talk about that a little more, but I'm glad that's helping.
Okay.
All right, now, do you smoke at all?
No, I quit about 30 years ago.
Oh, well, that's certainly good. I'm sure Dr. Clark's happy about that.
Very much so, yes.
In addition to the prescription drugs, do you take any herbal supplements or any vitamins?
I take a multivitamin every day. I'm not into the herbal supplements. Take a baby aspirin every day. And then the usual use of Tylenol or Advil for headaches or body aches, which seem to be more and more as I age.
Yeah. Do you ever take any medicine that's not prescribed for you, that's prescribed for someone else?
Well, I've got a kind of a bum knee, and I have a friend that has a bum back, and when we're together or the weather is really bad, I will often, not often, now and then take a Vicodin, one of his Vicodins for relief. Seems to help, but it's nothing regular, once a month maybe.
Okay. Your next checkup with Dr. Clark, you might want to talk to him about that knee pain.
Yeah,
Just to see what he's
I
thinking
agree. I
about.
haven't even mentioned this, of course.
Now, Do you drink coffee?
Oh, yes.
Okay. About how many cups a day?
About 6, I would
Ooh.
say. I'm a coffee hound. I usually keep a lot of half cups during the day, but I would say probably 6.
And how do you sleep?
I sleep very well. I don't, even when I'm drinking coffee, I don't have a problem. As I said, this burning in the esophagus affects my sleep to some degree, but I would say for the most part, I'm not, my sleep isn't interrupted.
Okay, and about how many hours do you sleep?
7 approximately.
Okay. Okay. Now, do you ever use anything like marijuana or any other street
Goodness.
drugs?
Oh, no. Oh, no. No,
Okay,
no.
don't want to offend you, just trying to
No,
understand.
nothing like
Okay.
that. No, I've never
Okay.
taken anything of that
All
type.
right. So we've covered everything that you take for kind of medicinal purposes.
I would say, yes, I would say yes.
Okay.
Are we finished with this?
Yeah, we're done. So what we're going to talk about now is reviewing some of your drinking habits. Is that okay?
Okay.
All right. So why don't you tell me right now about how much you drink?
Oh, perhaps 1 to 2 a night.
And is that beer, wine?
Wine.
Okay, so 1 to 2 glasses of wine
Right.
a night. And is that at night, before dinner, after dinner?
During and after, depends. Been doing this for a while.
Okay, so for a while. About how long?
Oh, 10, 15 years.
Okay, so long-standing. Wine with dinner. Are there any other times during the week, aside from the wine with dinner, where you drink?
I play poker with the guys once a week, and I drink beer then, maybe as much as 3. That's once a week.
Okay. And anything else?
Only at parties or weddings, that kind of thing. I might have some hard liquor drinks at that time. Brandy after dinner, gin and tonic before, and wine with dinner, that kind of an evening.
Okay. And so you said the drinking wine has been about 10 to 15 years. The other, the poker night?
Those are just, poker night for at least 6 years.
Okay.
And the other is just socially throughout the year, I would say.
Okay. Have you noticed any change in your drinking?
Yes, I have really. When I listed a party drink, a gin and tonic and wine with dinner and a brandy, I'm finding now that I'm less tolerant of that combination than I was 20 years ago. And so, I will opt for something else. I'll probably still have the wine, but I will opt for something else, maybe even non-alcoholic on occasion, because I can tell my tolerance is not the same. I'm a little buzzy, I guess is what I put it.
Okay, so you're noticing a decreased tolerance.
Yes, I am, and that's fairly recent.
Okay. I'm not sure if you've ever gone over this before, but something I thought was interesting were the standard size of a standard drink.
No, never seen that.
And for a beer, it's about 12 ounces, which is like a regular bottle of beer.
Okay.
For wine, a regular wine, it's 5 ounces, which is about the size of like a formal teacup. Do you think your drinks are about that?
I think mine are a little larger than
Yeah.
that. The average, I think wine glasses are pretty big, and I perhaps have, maybe 6, maybe 7 ounces. I think my wine glasses at home are 8-ounce glasses. So.
Okay, so a little bigger than the
Yeah,
standard.
a little bigger than the standard.
And I know you said most of your hard liquor is you drink it when you're out, so
Yes.
you're not actually fixing the drinks.
No, not at all.
But about a standard serving of rum or vodka or gin, like for your gin and tonics, would be about 1.5 ounces, which I think is about a shot.
A shot, yeah. And I always have those at bar places so that
Right.
they're being measured.
Okay, just interesting to know. Would it be okay if I did a few screenings with you about your drinking?
What's a screening?
Just to kind of get a little bit more information about what you're drinking and when.
Okay.
Is that all right? So I'm
Okay.
just going to ask you some questions. How often do you have a drink containing alcohol?
Every day.
And how many drinks containing alcohol do you have on a typical day when you're drinking?
1 to 2.
1 to 2. And how often do you have 5 or more drinks at one occasion?
I can't remember the last time that happened.
Okay, so that sounds like never, almost. How have you ever, sorry, have you ever felt that you should cut down on your drinking?
No.
Have people annoyed you by criticizing your drinking?
Well, my wife on occasion, on social occasions, and I think my daughter may have commented on it once or
Okay,
twice.
so your wife and your daughter. Have you ever felt guilty or bad about your drinking?
No, no.
Okay. Have you ever had a drink first thing in the morning to either steady your nerves or get rid of a hangover?
No, no.
Okay. And when talking to other people, do you ever underestimate the amount you actually drink?
No.
Okay. After you have a few drinks, have you sometimes not eaten or been able to skip a meal because you didn't feel hungry?
No, no. Actually, it usually increases my appetite.
Okay. Does having a few drinks help decrease your any shakiness or tremors?
No.
Does alcohol sometimes make it hard for you to remember any parts of the day or the night?
No.
Do you usually take a drink to relax or calm your nerves?
No.
Do you drink to take your mind off problems?
I would say yes.
Okay. Have you ever increased your drinking after experiencing a loss in your life?
No.
Has a doctor or nurse ever said they were worried or concerned about your drinking?
No.
Have you ever made rules to manage your drinking?
What do you mean by rules?
Oh, sort of contingencies, like you would stop drinking if certain circumstances occurred, or you would only take a drink if
Okay,
maybe
okay.
some of your poker buddies were there.
Okay, no.
No. When you feel lonely, does having a drink help?
No.
Okay, great. We're going to review the results a little later.
Okay.
When you came in, you had asked me what does bringing your medicines have anything to do
Yes,
with talking
yes.
to me. So one of the things is we had reviewed which medications you're taking, and one of them is Cymbalta. And one of the possible side effects with Cymbalta is that it might cause drowsiness.
Yeah, it says so in the bottle.
Exactly. And when you're drinking and taking the Cymbalta, it might increase the effect of the drowsiness. So I don't know, have you noticed anything different?
I have not. I take it in the morning and really don't have anything to drink until very late in the day, but I've not noticed anything.
Okay, so that's just something to be aware of. I know you also mentioned that you have some burning in
Yes,
your
yes.
esophagus. Has the doctor ever given that a name or?
Hurt or GERD?
GERD?
GERD.
Okay, and have you ever noticed whether that flares up or feels worse when you're drinking or after you've been drinking?
It's bedtime. When I'm going to bed is when I notice it.
Okay. Okay, so and we know that you have a couple of drinks
Yes,
tonight, so
yes,
there might be
yes.
something
Might be,
there or
yes,
not.
might
That
be.
would
I
be
don't know.
something that you might want to talk to Dr. Clark about. Has he ever mentioned anything with alcohol and any impact on the GERD?
He may have. I don't recall.
Okay.
Nothing specific that I remember.
Okay. Now, one of the things you mentioned is that you've noticed when you're at these events or a wedding is that you have a reduced tolerance. And that's actually routine in aging, that your body will have...
I just thought it was me.
No, it happens. Your body just can handles alcohol differently and not as efficiently. I know you mentioned that it does happen when you're at these events. Have you noticed it at any other times?
Oh, maybe I have a little less beer when I'm at poker nights now. I tend to switch to a glass of water or something and maybe cut down by one
Okay.
because I feel less connected. I don't know how to put it, but yes, I
Okay.
notice a difference.
Okay, so you've noticed that effect sort of
Yes.
more broadly.
Yes.
Okay, so that's good to know that you've been aware of that and that you've adapted. Now, one of the things I have here from Dr. Clark are some results of some tests he did last
Mhm,
time, and one of the tests showed that your liver enzymes were a little bit elevated, which indicates that the liver's having a little bit of a harder time functioning. Basically, what the liver does is it kind of cleans out the toxins in the body, and when it doesn't function well, the toxins can build up, which could cause some health problems.
Okay.
Some of those health problems, according to Dr. Clark, or some of the causes of the health problems can be cirrhosis of the liver, high quantities of street or prescription drugs, hepatitis, genetic liver problems, and alcohol consumption.
Well, I don't have any of those other things. The only thing on that list that might have any impact is alcohol consumption, I guess.
Yeah, and are you surprised by that?
Yes, I am. Only because I've been drinking about at this level for a long, long time.
Yeah, so it seems like all of a sudden everything you've been doing might now be having some health consequences that you didn't have before.
Yeah, looks like it. Looks like it.
We've talked about a lot of things today, and I was wondering if you'd be interested in knowing where you fall on the continuum for people your age.
Sure, why not?
Okay, about 2/3 of people your age don't drink anything at all for a variety of reasons. About 5% have a real severe problem with drinking, and you're not in that group. You fall into this middle group that's considered at risk, where you have more than 7 drinks a week.
Are you saying that I'm an alcoholic? Is that what this test is doing?
No, that's actually exactly not what I'm saying. When I say at risk, I mean at risk for health consequences, negative health consequences as a result of drinking.
What are you talking about as far as health consequences?
Well, some of the things we've talked about already, the potential for alcohol to cause drug interactions, for alcohol to cause problems with liver function, and something we haven't touched on, but alcohol can also cause an increased likelihood of falls. So really looking at it from an at-risk of your health perspective. Not interested in calling labels, and I'm sorry if I was conveying
well,
that.
I don't want to be labeled, and I don't want my medical records to reflect a label. That's what I'm concerned about,
and
of
I
course.
can totally understand that concern. I don't use the term alcoholic a lot. I don't find it terribly useful or precise. It's very vague.
Okay.
My goal is really to look at, to talk about the risk factors for health problems.
Okay, I understand.
Okay, so that sounds like, though, that this is really upsetting to you.
It is a little, but you've given me some encouragement. Okay, go ahead.
Okay, so would it be all right if I reviewed some of the recommended guidelines for drinking for people your age? And they're from the Institute of Medicine, so I'm not just making these up.
Okay.
Okay, for men over 65, it's recommended that people drink no more than 1 drink a day. It looks like you look of surprise.
Well, it doesn't seem to be in the real world, but you can go ahead.
Because it's different from what you're experiencing right
With
now?
myself and others like myself, I think that my friends.
Yeah. I can totally understand that. I think part of it is, again, these are recommended guidelines, and again, it's looking at it from a health consequences. For women over 65, the drinking guideline is actually less than 1 drink a day. So this has been a lot to take in.
Yes, very much so.
Yeah, so things you've been doing your whole life, and all of a sudden someone's saying that it's having all these consequences that maybe you never thought of before.
Well, certainly Dr. Clark is pointing out some consequences.
Yeah, so, and how does that make you feel?
I'm very uncomfortable with this. It's new. It's news. It's a little scary.
Yeah, I'm wondering if you're sort of thinking ahead to how this might, impact your life, and kind of, I know you drink with your poker buddies, and I know that's an important part of your life.
Yeah, that and just general health in general, that kind of thing, because I don't have heart trouble, and I don't have diabetes, and so I just sort of assumed that I was generally a healthy person, and that this didn't really have any effect or impact on me.
Right. Well, I think the good news is, you have that elevated liver function, but I'm not saying that you have all of these things now, but it's really an opportunity, again, to look at those risk factors and maybe look at, working with Dr. Clark, ways that you might be able to avoid some of these negative health consequences. But I know.
Okay, I understand.